Okay, this is case number 8, relatively very informative case about diabetic patient who comes for diabetic follow-up. A lot of information to type, and let's get started and see how it's going to work. I'm going to set the time. Requirements of this finish it 10 minutes at least. Okay. Insulin. Blood sugar level ranges between 120 and it's later last because later level A S was 6 7%, and meals and choose numbers especially at night. Loss of erection, erections, 2 years, absence, injections, and we pay. Change no special diet, no exercise, transfer, no pharmacology, medications, aspirin, history, function. 1 years ago, hypercholesterol. which patient are you going for? Now this is drug use. This is drug use. Application closed. It's family history. Father died of cerebrovascular accident at age of 60. So patient is in distress. Diabetic neuropathy, neuropathy, and orphan, and blood dysfunction, dysfunction, and yeah, what we do, we will check definitely it's a genital exam, and serum glucose, hemoglobin, 1CS, we do urine analysis, we do urine microalbumin, we check the kidney function, blood urea, nitrogen level, creatinine. We also do Doppler ultrasound of penis, and we also conduction nerve studies, nerve conduction studies, It's necessary, and we're gonna history of having this copy goes everywhere, supportive for every case, and treatment with insulin complement monitoring regular, so pretty tight control. Copy, paste, with rapidness, and location application diagnosis. Copy, paste the results after taking images after insulin. Copy, paste the form for the loss of research here. Tingling. Copy, paste, and it's got here loss of ejaculations. Copy, paste, and medications. Certain medications can cause erectile dysfunction. The guy was well, beta blockers at the moment can cause this too. Now, 2 minutes left to finish this part. Vital signs. Those are the normal limits. What we have to see. GBD. Actually, it goes for the neck. This one neck. Like this. Yeah. And here. PS2, normal, no, normal, gallop, rubs, and then soft, tender, understanding, what sounds positive, no, that is going to be negative, extremities, no, edema, no, skin, breakdowns, pulse, pulse, or dorsalis, penis, pupils, which is normal pulse, neuro, around the time, but then you keep going, motor, about motor, strength, 5, and bilateral power, extremities, deep tendon reflexes, symmetric, knee, jerk, reflex, two positive, ankle, jerk, reflex. Yes, absent. This is the immunology flying knee. Will actually grow from nephropathy here. 0 means that it's the ura, there's nothing. And what else? Sensation. Alt 25. Decrease it to soft. Soft touch. Pin to soft. Sharp. Sharp. Vibration. Section. Basically that's it. And the lateral 12 minutes, too much time spent. 12 minutes behind the actual limit. Very important case, very descriptive case. I would say like C. He is compliant to medications, takes insulin. It's with a tight measurement of his blood sugar level. Regularly monitoring, that's what predisposes. Maybe he can get insulin-induced hypoglycemia. This is supportive evidence of that. Occasional episodes of palpitation, diaphoresis, after missing meals, and results after drinking orange juice. It's pretty obvious. Another thing, like normal limits of the fasting glucose in the serum, it's 70, 110. On this case, it's 120, 145. It's a higher than normal range. Like glycosylated hemoglobin should be less than 6%. Here it's a 7%. So loss of erection, organic cause versus psychogenic cause of the erectile dysfunction. There's some vascular pathology going on. That's why there's a Doppler of the ultrasound Doppler of the penis should be evaluated, included in the diagnostic studies. Medications can cause low-estatin ethanol and loss of history of 25-year diabetes mellitus. Is evident. Another thing, like very surprising, the patient is not in angiotensin-converting enzyme inhibitors, which is protective for the to preventing the develop diabetic nephropathy. It definitely should be prescribed, but in this case, patient is not taking in analysis. It didn't say anything. Other case, it's he's taking ethanol. Ethanol should be actually a beta blocker. Should be used contraindicated in diabetes mellitus. At least should be used with extreme precautions because it predisposes patient to the insulin-induced hypoglycemia. Why? Because we know the release of contrarregulatory hormones, glucagon, for example. Glucagon is a contrarregulatory hormone to the insulin. And release of the glucagon is under influence of beta-2 adrenergic receptors. When we use beta blockers, we block that mechanism. That's why we can predispose actual patient for insulin-induced hypoglycemia, we can kind of explain this here. History, we can add like having atenolol would be the good case, atenolol. Basically that's it. It's the diabetic patient. Comes for diabetic follow-up. Everything is described. 12 minutes was not enough. And thank you very much for your attention. And see you next time. Bye-bye.